So good evening, ladies and gentlemen. Thank you again for being with us. This evening we're confirming to you that we have diagnosed through our Irish laboratories an additional 548 new cases of COVID-19, and we've been notified of an additional 284 positive samples from the German tests that you've been hearing about in the last number of days, bringing the total number of confirmations from all sources to 11,479. We have been notified additionally today of 41 additional deaths, 36 of which are in the east of the country, 4 in the west, 1 in the south. Of these 41, 16 are female, 25 are male, and 31 of the 41 we have reports of underlying conditions, and that brings the total number of deaths to 406. And again, I'd like to take this opportunity to express our condolences to the families and to the friends of each one of these individuals. A little more detail on the 406 deaths. 266 of those occurred in a hospital environment, that's 266 or 66%. 40 of them occurred in an intensive care unit, that's 10%. 338 we have reports of underlying medical conditions, that's 83%. The male-female breakdown is 240 or 59% male and 166 or 41% female. And the mean age is 69, the median age is 82, and the range of ages is from 30 to 105. In terms of intensive care unit admissions, we've seen 277 to date. 160 are currently in an intensive care unit, 58%. That's a slight drop since yesterday. We've seen 77 discharged, that's 28%. There have been 40 deaths, as I've said, and that's 15% of intensive care unit admissions. The median age of all intensive care unit admissions is 60, and we have reports of 79% or 218 having underlying medical conditions. A further breakdown of the 10,385 cases that have been notified from all sources to the HPSC as of midnight on Sunday night just past was 1,903, or 18% of them had been hospitalised. 275 were admitted to intensive care, that's 2.6%. We had reports of 408 clusters accounting for 1,099 cases. 26% of all of the cases were healthcare workers. The median age of all those incident cases is 48, and the female to male breakdown is 54% to 46% respectively. In terms of clusters, we have reports of 238 clusters, up from 233 yesterday, across residential facilities in the community. 156 of those are in respective nursing homes. That figure was 157 yesterday. We have seen 187 deaths associated with the clusters in nursing homes. That's an increase from the 167 figure I gave you yesterday, out of a total now of all deaths associated with residents in nursing homes and community residential settings of 222, an increase from the number of 199 that I gave you yesterday. We held a meeting of our National Public Health Emergency Team today. We made a small number of recommendations which we have communicated with the HSE, and we'll be happy to answer any questions in relation to those. But before we do, I'm going to introduce again